I want to welcome everyone. I'm Steve Eubanks. I'm a dermatologist from Denver, Colorado. Today, I plan to speak on one of the technologies that are on the InMode aesthetic platform. Now, this platform as a whole has 5 separate technologies. The first, and the one we'll actually talk about today, is the Fractora, which is a radio frequency needle insertion device. The second technology is they have both Forma and what are called Forma and Forma Plus. It's another radio frequency device, but this is for bulk heating of the dermis. The next device available on this platform is Lumeco, which is truly a unique IPL device. They also have Dialaze, which is another unique scanning 810 nanometer diode laser hair removal device. And the last technology that's available on this same multi-platform applicator is the Body FX. And this is really a unique radio frequency device that incorporates what's called electroporation. And this allows you to both empty fat cells and to destroy fat cells, and is used for body contouring. So I consider all of these different devices in this platform as to be first in class. That's a very unique thing. No other device has so many of what I call first-in-class devices available on a single platform. But today I'm only going to discuss Fractora, and I'll try to explain the technology and then go over how I use this in my practice. So Fractora is what we could call a bipolar radiofrequency needle. This diagram shows just a drawing of how this works. And the things you want to look at in this drawing is you see the needle insertions, which are black. And when the radio frequency energy is delivered, it makes a local effect, but it also has a much broader effect deeper in the dermis as that radio frequency energy leaves the needle and returns to those negative electrodes. So I consider Fractora a combination of both ablation and subepidermal heating. And one way to really look at this is you think of this as really a combination of almost an ablative fractional CO2 laser with what Syneron, for instance, would term sublative dermal heating. This is just another drawing showing that each needle has an area of ablation, has, depending on the energy used, has an area of surrounding coagulation, and then a much broader area of heating. This gives you combined effects that make this such a useful technology. So now what I have on the screen are the 3 main tips or needle applicator tips that I use with this device. And these needle tips insert into a very lightweight tubular structure to actually do the procedure. We call this the Fractora family of tips. The first one that I'm showing you a photograph of here is what we call the 60-pin tip. And they call it that because there's 60 little needles that insert, and they insert down to a level of 600 microns or 0.6 millimeters deep. What this does, and you see this again on the diagram to the right, is the 60-pin tip is thought to have medium density and mid-dermal heating, but it also has superficial fractional ablation. I use the 60-pin tip for fine wrinkles. I use it for enlarged pores. I use it for facial pigment and facial vessels. And this might be a time one of the ways that radiofrequency works to treat pores, which no one would think, is that where laser will just go in a column of damage, and the radio frequency, when it goes into the skin, actually moves around, and when it moves around pores, it heats pores on the outside of them, and that tends to remodel the collagen around pores and scars. This is a photograph of just where one half of the face was treated to show you the difference with a 600 or 60 pin tip that shows just mild erythema when you're done with the application. Another tip that's available is the 126 pin tip, and this inserts to the same depth of 600 microns. It's a much more superficial, high density tip. And I have to be honest, I almost never use this tip in my practice, but the people who do use it, you can use it for texture, enlarged pores, and pigmentation, the things that I primarily use the 60 pin tip for. The last really two tips are called the 24 pin tips, and these can be either coated or non-coated, and these are much deeper. They insert down to 3,000 microns or 3 millimeters. With a non-coated tip, the 24 pin tip, you get full thickness ablation all the way down to 3,000 microns. This shows you where you're getting that complete full thickness ablation down the length of the needle. But there's more to it than that, so you still get that deep dermal heating that's around these needles that adds a second type of heating to the collagen around where you're getting your ablation. And this is just a photograph showing someone who's had the uncoated 24-pin tip treatment, and then up close you see the individual fractional areas showing epidermal damage, which is what you're trying to do with this particular type of pin. This is a histology, again, showing a full thickness damage through the epidermis and the dermis. Now, you might say, well, I don't want to damage the epidermis. Well, I'll show you in a moment. You have that choice, but many times you really do want to have more full thickness when you're trying to treat pigment, vascular lesions, and wrinkles in general. So what do I treat this with? Deep wrinkles. I use it for skin tightening, and it's especially useful for acne scars. And the last tip that is available with the Fractora is what's called a coated 24-pin tip. Same depth of 3,000 microns, but this is covered by a silicone sheeting that covers everything but the very tip, and it's used to prevent an interaction with the epidermis. So here you have no epidermal damage. This is a close-up showing where the silicone coating is covering the tip, but the tip of the needle is where the heat is released. And so what do you get when you do this? You get ablation down at the 3,000 micron level, but you don't have any epidermal damage because it's protected. So in this diagram, you see the area of protection, but you also have the deep areas of ablation and the dermal heating that's similar to the other needles. Again, this is a photograph of an area that's been treated with the coated tips, and when you look up close, there's none of the epidermal damage you saw with the other. You just have erythema and because of the deep dermal ablation. Histology, again, showing an intact epidermis with good changes in the dermis, but nothing in the epidermis. Where is this the most useful? By far, this is the most useful in darker skin. You can treat type 4, 5, and 6 skin with this because you're having no impact whatsoever on the epidermis, so there's no risk of post-inflammatory hyperpigmentation. or lightening of the skin. I use it a lot for skin tightening, where you want to turn up the energy and have a lot of underneath dermal damage but nothing on top. And again, we use it a lot for acne scarring, especially in darker skin. Those are the basics of what the machine has. So how do I go about treating? What are some of the things we look at? Well, there's three different approaches. One is what I call low energy settings, and this is with either the 60 pin or the 24 pin. And if you're between 10 and 25 millijoules per pin, I consider this a very superficial treatment. This can be performed by ancillary providers, medical assistants, anyone who would do your lower level treatments, and we use topical anesthetic alone for this. Now, if you start to increase the energy, you get a deeper effect and you get more effect. Still, most places use ancillary providers to do this, and you can still use topical anesthetic alone for this. But now if you go to the high settings, which is from 42 to 62 millijoules per pin, this is a very aggressive, very deep treatment. Most people feel this should be performed by medical providers, either an RN, a nurse practitioner, a physician's assistant, or a physician. In order to do these settings, you have to use a combination of topical anesthetic, and I use injectable tumescent anesthesia for this. So what is the anesthesia that I use? The topical is a combination of lidocaine 23% and tetracaine 6%. This is available in many different locations. I have it made in Utah, but you can get it in lots of different places. We apply this depending on if it's low energy for 30 minutes, if it's high energy for an hour. Now, tumescent anesthesia is just diluted anesthesia. The way I do it, the way I was trained, I use 30 cc's of lidocaine, 1% plain, 30 cc's of normal saline, 6 cc's of sodium bicarbonate, and then I add epinephrine to it. You can also use lidocaine with epi, but I think there's a little higher amount of epinephrine in that mix than it is the way I make it up. But as with many things, this is just how I was taught. So this is the anesthesia. And use a fairly large volume, and I inject with a fairly long needle from 2 or 3 pinpoints on the cheeks or the necks that I've numbed up, and I move that needle under the skin and inject this anesthesia. It's very easy to do. Patients have almost no discomfort while you're injecting this diluted anesthesia. They don't have any of the burning. So what is my protocol for treatment? Primarily, whether I'm treating acne scars, skin tightening, or just wrinkles in general, I first treat with a 24-pin tips. And what I do is I do what's called double or triple stacking. And what that means is you insert the needles, and then you just fire 2 or 3 times without moving it. The first firing of the radio frequency tends to seat the needles better, and the second and third tends to deliver the energy. And then I move it about 30%, and what you're trying to do is move it so that you don't overlap the electrodes, and they don't fall on the same spot. This is just an example of how if you overlap about 30 to 50%, you aren't overlapping those return electrodes. And if you do that, it tends to keep you from having too much energy in one spot. And then after I've made one pass, depending on the severity, I'll make a second pass, and I've gone horizontal rows, overlapping 50% vertically and horizontally. Then I turn the electrode to come vertically over that, say an area of a cheek, and do the same thing for a second pass. So there's multiple stacking, which is energy in the same exact spot, and then there's multiple passes, and you can do both depending on how much you want to do. And then what I don't have a slide for is after I do the 24 pin, I then usually make a pass with a 60 pin, and I may have had my fluence from 52 to 62 with a 24 pin. Then I lower it to probably 42 millijoules for the 60 pin and go over the whole area, but you do not stack the 60 pin. You do single pulses, and then you do the same 30 to 50% overlap. And that's usually the treatment. Takes a full face in the 30-minute range. So how about some clinical examples? The first is vascular lesions. These are treated with the 24 pin tip at 50 millijoules per pin. This was a patient of Dr. Mulholland's, single treatment, and vessels, which you wouldn't think would go away at all with a fractional device because of the way the energy spreads out. It's very effective at treating vessels. It's another patient who had a combination like I normally do of using the 24 pin followed by the 60 pin to treat primarily vascular lesions. How about pigmented lesions? This is another Dr. Mulholland. He used the 60 pin tip at 60 millijoules, a single pass, completely removed the pigmented lesions. This is a patient of mine. I have to admit, when I first did it, I didn't know how well it would work on her pigment, but you can see that it not only has tightened her skin, but has almost completely removed all of her pigmented lesions. And this was a combination of the 24 pin where I triple stacked, but at a fairly low fluence of 50 millijoules, and then followed that up with the 60 pin. And so really good treatment for pigment. Then we can do skin tightening. This is Dr. Love did this with a 60 pin tip alone, a single treatment. You can see amazing tightening. The Fractora is just a phenomenal way of treating for skin tightening. Another example, Gary Lask did the combination like I normally do with a 24 pin followed by the 60 pin. Now, in order to do this, you have to do the tumescent anesthesia in this area. And these are some slides to show you how quickly the healing occurs most of the time with Fractora. This is a patient one day after her treatment, and this is showing the same patient 1 week after the treatment, basically completely healed. There's a little bit of a typo. This was supposed to say 60 pin tip at 42 millijoules, single treatment, single pass. And this is a same patient, 2 months, is completely healed and has what I think is significant tightening of the neck. Then we use this for treating acne scars. This happened to be a study that was done, and it's an unusual study. We don't normally do it this way. They didn't have the 24 pin tip when this was done, and so they did 4 sessions using just the 60 pin, and I still have moderately good results. Today, what I would do here is I would absolutely treat this with 24 pin, multiple stacks, 2 passes, followed by the 60 pin, a single stack, and then 2 passes. Wrinkles, this is what we really want to do with this. This is one of my patients that had a single treatment, but I combined both the 24 pin and the 60 pin, and she has really good results around her mouth. They're very hard to treat. This is another example. There was pigment, there was tightening to be done, and she has a really good result from the both the 24 and the 50. This is a patient we just did the 60 pin at fairly low fluences. She was healed in about 3 days, and has a good if you look carefully, you can see there's much more uniformity of the pigment, and fine wrinkles were reduced. It's another patient that had, if you look, much brighter result on the right after treatment, more uniform pigment, tighter skin, less wrinkles, using the 24 pin followed by the 60 pin. This is a patient from Dr. Barrel, and this was done with a single treatment using the coated 24 pin. And this, I believe, is a patient out of Israel that had a little bit of Mediterranean skin. You didn't want to have as much damage to the surface, but you can get tremendous tightening of these wrinkles and rhytids, or even around the mouth, with the coated 24 pin tip. Now, for active acne, Dr. Hellman has done a fairly large study showing good results of treating active acne, where you're actually targeting the sebaceous glands, sort of what we once did with Candela's Smooth Beam. You can actually get good, long-lasting results using it was the coated 24 pin tip, and pretty aggressive treatments. So to summarize what we do with the Fractora, I think this is the only device that can combine either minimal or deep ablation with coagulation and subepidermal heating all in one device. So this really offers a complete rejuvenation ability with a single device. So what does this compete with? This competes with Syneron's ablative, Syneron's profound, or what used to be called the E prime, Lutronics Infini, just non-RF microneedling, and fractional CO2. Let's look at each one of these. The Syneron's ablative is pure fractional radio frequency. It uses a grid of electrodes, so it doesn't have needles, but it has and the whole purpose of it is to have minimal effect on the epidermis. That's not what you're trying to do with ablative. You're trying to get energy underneath the surface. In contrast that with Fractora, that combines very, very similar, and it's similar because the same, Dr. Crendel invented both the ablative and the Fractora. So he has the same dermal RF effects that ablative has, but he also has the ability to either have almost nothing on the surface or an effect that's very similar to full fractional CO2. The Syneron Profound, or E prime, is another deep needle mechanical insertion device. The reason I don't use that device anymore is I found it very difficult to hold those needles in the perfect position for the 3 to 4 seconds each insertion demands. And it's also 60 to 70 degrees centigrade, and I've not been convinced that that was not too much energy. And then when you look at the other things that happen with this device, you get significant bruising from this treatment. At least I did, and we've had some people have some persistent numbness because the high energy of these needles, and there are only 5 pairs of needles, so 10 total needles. And I think the real difference between Profound and Fractora is Fractora can have the same deep effect, but it also has the ability to treat superficially. Because the Profound only has coated needles, so we don't have that flexibility that we have with Fractora. So another device is Lutronics Infini. This is a fractional RF needle vertical insertion were profound was inserting them at an angle. This inserts them vertically, and they can do superficial or deep, and they have coated and uncoated needles. I think the way that they insert the needles through a mechanical insertion is a little bit fragile. It's not quite as robust as just being able to push the needles in with control of your hand. And the other thing that's really hard with a mechanical insertion device like Infinity is it's almost impossible to stack pulses, because between pulses you're pushing it in, bringing it out, pushing it in, and those repeated mechanical insertions are rarely in exactly the same place, where with Fractora they're in and you don't move it until you've done all three stackings. And I think the Fractora needles are much more sturdy, and so the ability to not have to mechanically push them in each time and wonder if they're really where you want them is a big difference. So how about non-radiofrequency microneedling? This is very popular, certainly in spa areas. These are just very superficial needle holes through the epidermis. There's no added energy, and you really can't get much epidermal or dermal reaction with microneedling. I mean, the only thing I think microneedling might be useful for is to put lotions and potions and have it help you get them into the dermis. I just think without adding any energy, you simply can't get enough dermal collagen remodeling. And last is fractional CO2, and we've long thought this to be the best treatment for wrinkles, and it's a very versatile device. But I think Fractora can deliver almost the same effect, but it also has the ability to do non-ablative, so you get the combination of ablative and non-ablative in a single device, where with CO2 it's strictly an ablative column. And I want to thank you for listening to this webinar, and if there are any questions, I'll be glad to answer them. Thank you. Well, that's a good question. So when I look at resurfacing, I look at it as a kind of a spectrum of different procedures. And I start with thinking about color correction. I think about non-ablative resurfacing. I think about skin tightening. And I think about deep wrinkle removal. So I use the Fractora to accomplish what I think of as non-ablative, but lower energy dermal ablation or energy delivery. But you can also go much more aggressive with this. You can do a combination of a minimal amount of non-ablation versus much higher. Then using the coated 24-pin tips, you get a lot of skin tightening. And then if you really increase the energy, you can get this deep wrinkle removal that's really almost equivalent to CO2 laser. One of the advantages of having the entire platform is you really can combine multiple modalities. And I know we haven't talked about the other modalities, but I frequently combine Fractora with Forma or Forma Plus. And I use the Fractora for more superficial skin tightening, and I use Forma, which is very non-invasive, as a more deep skin tightening in areas that you don't need to have much superficial change. The other thing I'll combine a lot is I'll combine Fractora with Lumecca, which is InMode's intense pulse light. And I'll treat first with Lumecca to take care of all the pigment, either red or brown, and then follow up with Fractora to do more of the wrinkles. And this might be a time to mention briefly about Lumecca, where I think all the IPLs work fairly well for pigmented lesions, but this is such a high energy IPL that it really also works well for vascular. So the combination of Lumecca and Fractora has been really good for color correction.